not as big a concern as it's been lately because of the same thing that we see happening with Dad, and they're out there by themselves.
Okay.
One thing that
So
has,
little by little, no strokes setting this off that you
Well, I
know
wanted
of
her
or
to
anything
tell you
like
about
this.
that, Mom. See, you're forgetting to tell them about your stroke.
well, I did have a minor stroke. I think it was called an ATS or an AT something,
TIA.
TIA, a couple of years ago
Mhm.
that sent me to the hospital for one day.
Yeah. All right. You had an MRI at the time. It did not show a stroke, so there was that kind of a mini. Some people call it a mini stroke, even though it's not a stroke,
That's good.
or like a warning stroke.
Wasn't a stroke.
Okay.
Well, not that they could see. There was some technical artifacts with this imaging, so it wasn't the best quality. But do you have any persistent symptoms from that event?
No.
No. Okay, so it was probably a TIA, which means you went back to normal eventually.
When I say go back to normal, I certainly don't have the short-term memory that I used to have.
You know, that's a good point she's making. It did accelerate after that event.
I am trying to keep careful notes of every phone conversation with an advisor or whatever, so that it's in writing. It's not in memory.
All right, so here's what we're gonna do. Let me. I'm going to evaluate you further for your memory. And then when we come together, I can tell you more about what the reason for your memory loss is.
Okay.
Okay, and what we can, more importantly too, probably what we can do about it.
All right.
So I'm just gonna get an MRI of your brain.
That sounds complicated.
It's not.
She's already got an MRI. They just prescribed for her lumbar region
Yeah. All right.
because of her spine.
Yeah. Well, this is gonna be obviously different then.
So you got two MRIs coming up, Mom.
Do you use a computer at home?
Yes, I do.
All right. We're gonna do a neurocognitive testing, which is computer based, but in our office. I just want to make sure you know.
I have very limited skills on the computer. I know what I need to know, and I don't know the rest of it.
Well, there's nothing on our computer. Is nothing more than to click on things.
Okay.
So
It's not a computer
if
test.
you
it's
have
just-
ever used a computer, then you would be able to do it.
Okay.
And then let me also check. Now, it may or may not turn out to be Alzheimer's. Over the last 2 or 3 years, we have had treatments to slow down the progression of Alzheimer's. If that treatment is an infusion, intravenous infusion, every 2 weeks or every 4 weeks, we have 2 different medications available. So it can be given every 4 weeks or every 2 weeks. If you're potentially interested in a treatment such to slow down if you do have Alzheimer's, which we don't know at this point, we would do specific blood tests to look whether you have Alzheimer's or not.
Okay.
Do you want to do that?
It certainly doesn't hurt to do the tests.
Well, it's a blood test, so it will hurt a little.
Yeah.
All right, so let's check that all out, and then I see, we see you back.
The question is, what do you do when you find the results?
Well, then we talk about treatment. So, So I don't know whether you know that. I I don't know for sure, but if it's Alzheimer's disease, we have no cure for it. And we couldn't do really anything about it other than boosting memory a little bit until about 2 years ago. And since that time, therapies have come about which actually slow down the progression.
Do you find that the treatment is successful, or
Yeah,
at least
I mean, it's not a personal
borderline?
opinion. We do have dozens of patients
Sure.
between here and Okati praxis on this medication. It does help some people more than others, but clinical trials have clearly shown it is a benefit. It clears out the amyloid, which is accumulating in the brain with
Okay.
Alzheimer's. And it
Does
clears
it
out the
interact or affect any of the other medications that I am taking?
we would look over that if that's applicable, but I don't see that right now. So, we would see you back after the testing. Today, blood test, MRI is scheduled, and neurocognitive test is scheduled.
Blood test today while we're here.
Yeah, on your way out. And then
what is the next test? An MRI, you said?
Yeah.
Is that done at Beaufort Memorial, or?
it can be done at Beaufort Memorial. Usually we do it there, yeah.
Dr. Bell, you want her to do her cognitive test while she's here today?
We can't probably. You can double check up front whether we have capability for.
Well, we can come back.
capability. You can double check with them.
If you want her to, is that okay?
I would. If for me, it doesn't matter. If you can do it today, then it would be great. But I'm not sure whether we have the office staff. Usually we do it electively. We give you an appointment for it, but it may be that we have enough.
I can bring her back.
Mm-hmm. Yeah, but you can ask up front. So if it's possible, then sure.
Save you a trip, Mom.
Yeah.
Absolutely.
I am very aware that my short-term memory is incapacitated.
See if he can give you some recommendations.
All right.
We already got some. And then you're not the first one they've ever seen
Of course
that
not.
has this.
Yeah. And again, we don't know at this point, so we just need to wait. Meanwhile, you're gonna take your B12. Who knows? Maybe you come back smarter next time than this time. Okay.
And is that a one time a day?
1 time a day, yeah. Just 1 pill. So it is a little, yeah. So you remember all this, right?
Yes,
Because
sir.
I just remembered myself the B12.
Well, and I've got all of her power. I just filed all the power of attorney and
Yeah.
stuff, so I can call you guys if I have a question now, right?
Absolutely.
Yeah. Just hope you keep on his recommendations, Mom.
Mm-hmm. What do you find the most concerning?
The most concerning, I find that you repeat yourself a lot, that you forget that you just said
Right.
something or some people told
Right.
you. And that's reflected here on our test today. So you are somewhat disoriented to especially the short-term stuff like what day it is today,
Mm-hmm.
what day of the week and what day of the month, and then also the recall. You did not remember the 3 things we asked you to remember. So it's all short-term memory.
Okay.
Yeah. All right, so you can take this all up front and they will process it from there.
Very good.
Sounds good?
Thank you.
Thank you, Joe.